I've said this from the moment that we started this work, which is that health begins in communities, not clinics.
Cardiovascular disease continues to be the number one cause of death and disability in this country, and it is preventable, or at least we can prevent its progression. And through the years, we've seen that there are other things that influence the health outcomes, particularly cardiovascular disease, that is not seen in the doctor's office or not treated in the doctor's office.
Access to healthcare is a problem in many places in the country, both urban and rural, meaning people who need healthcare can't get to it, don't know how to get to it, can't afford it, or when they get to it, it's not very good. So we're trying to address all of those problems by making care available to people in communities where care is either not available, difficult to access, difficult to understand, and not really applicable because of their different cultural needs.
The recipients of AHA funding are changing their communities because they're meeting the needs of the communities when others are not. And our recipients of funding are those people. They know the communities, they know the people, they know the issues.
New York is only one of many cities, right, who have urban populations that sadly have health deserts and have high populations of vulnerable and marginalized kids.
Strong Children Wellness is an innovative approach to primary care that partners with communities to address a family's needs holistically. We work as a team with our community partners to really understand the family's needs as a whole and then work collaboratively to help solve them. We're seeing the kind of outcomes and starting to see the needle shift around certain outcomes, we think, because of this collaborative care.
We're a grassroots community-based organization that is peer-led, peer-run, and our primary services are peer support services in the area of mental health, substance use, behavioral health in general. We don't treat just one symptom. We want to make sure that they're whole and their wellness is being treated comprehensively, meaning body, mind, and heart.
1 out of 5 kids in the U.S. experience a mental, emotional, behavioral health disorder. That number is doubled for Black and brown children. So you can see there's like a very large gap, a very large access gap. And so it is so important for us that we're filling in the gap.
The American Heart Association is incredibly proud of the work that it's doing. It is changing communities by investing in entrepreneurs who typically don't get funding.
If you're a first-time founder, you're doing something that you've never done before, and the chances of success are slim.
You know, when you're on your own and you're kind of doing something entrepreneurial, you have a lot of self-doubt. To have a partner that has the reach that AHA does, believe in this work and commit to sustained partnership helps to kind of motivate us to keep pushing forward.
We are funding organizations that are focused on giving people a chance to have their best health. So organizations that we fund are really excited to have the American Heart Association behind them because it is a well-respected, scientifically based organization.
The Social Impact Fund has been catalytic.
Folks know that we're a science-based organization, so that means that there's going to be rigor, that means that there's going to be discipline, that means that there's going to be impact attached to partners that we have.
Prevention is so much easier than treating the disease.
You too can drive significant change in communities, addressing the social drivers of health, which play a significant part in someone's ability to live a longer, healthier life.